Hello. I start by acknowledging the traditional custodians of the beautiful lands and waters where you are meeting today, the Gadigal people. I pay my respect to elders past and present, and I extend that respect to all First Nations people here today. I recognise the enduring connection of Aboriginal and Torres Strait Islander peoples to country, and I invite everyone to reflect on our shared responsibility to honour and respect this special place and its stories. Thank you for the opportunity to share this short reflection with you. I apologise for not being able to join you in person for the Health Justice Australia conference this year. As Australia's Chief Medical Officer and the first general practitioner ever to be appointed to this role, I am very pleased to have the opportunity to add my voice to your important focus on the future of health and on the partnerships that make better outcomes possible for every person, every family and every community in our nation. When we talk about the future of health, it's tempting to focus only on clinical breakthroughs, like new diagnostics, therapies and digital tools. These of course matter, but as you all appreciate, health is shaped just as profoundly by the context of people's lives, their housing, their work, education, the safety of families, connection to culture, access to justice, access to health services, the strength of local services, and much, much more. If we confine ourselves to a purely biomedical lens, we risk missing the complexity that people live with every day, and then we fail to design systems that meet people's needs. This needs to be a shared endeavour. We need to draw together the expertise of clinicians and researchers with the wisdom of communities. We need to connect primary care, hospitals, public health and prevention with legal, social, housing and community services and more. And we need to co-design solutions that reflect the lived experience of people. Embedding this broader view also strengthens equity. When we design for equity from the outset, including recognising the distinct needs and strengths of First Nations peoples, of migrant and refugee families, of people living with disability or with chronic health concerns or mental health challenges, of young people, of older people, of those living in rural and remote communities, those on low income, people who are homeless, those who have experienced incarceration, and many, many more. When we design for equity for all, we lift outcomes for everybody. Equity shouldn't just be an aspiration. It should be a standard we both deliver and measure. In my role as Australia's Chief Medical Officer, I'm privileged to see the difference that genuine collaboration can make across the Commonwealth, states and territories, between health services and the justice sector, and through alliances with universities, research institutes, community organisations, and more. The best results come when we connect data, evidence, and lived experience together. And when we remove barriers to team-based care, so multidisciplinary teams of people can do their best work. Integration matters at every level. A local clinic coordinating care with a legal assistance service, a hospital working side by side with social services on effective discharge planning, and nationally as we align public health, primary care and preventative strategies. Innovation is not just about technology. It's about new ways of working together, harnessing digital tools when appropriate to overcome distance and disadvantage, but ensuring that those tools empower and that they don't exclude the very people that they are designed to support. None of this happens by accident. It happens because leaders and practitioners commit to partnership and because we align around shared purpose. That's why this conference is so important. Health Justice Australia has created a unique space for leaders and practitioners across health, justice and social care to come together with the community, to test ideas, to convert good intentions into tangible integrated solutions, to explore how clinical and community expertise can combine and how legal partnerships can reduce health-harming problems, and how system integration can turn complexity into effective person and community-centred coordinated care. Your work today should be catalytic, taking us from discussion to delivery. So wherever you are based, perhaps in a clinic, a hospital, a community organisation, a legal service, a university, or a government agency, I thank you for your participation in this meeting, but more importantly, for bringing your experience, your evidence, and your questions to this forum, for challenging assumptions, for sharing here what works and what doesn't. I hope this conference will deepen partnerships, align efforts, and chart some practical paths forward. Our common ambition is clear. We all want a health system that delivers the best possible health and well-being for everyone, for all of our patients, for our communities and our nation. A health system where care is connected, where digital tools empower, and where equity is a measurable outcome that we achieve together. I look forward to hearing how you are turning principles into practice and partnerships into real progress. Thank you all.